Can you test for HIV during the window period? Imagine you've had a potential exposure to HIV and want to know if you're infected. You might wonder if testing right away can give you an answer. The truth is, you can take an HIV test during the window period, but the results might not tell the full story. The window period is the time after exposure when the infection markers in your body are too low to be detected by most tests. This period can last from about 2 weeks up to 3 months, depending on the type of test used. Different tests have different detection times. Fourth-generation laboratory tests, which look for both HIV antibodies and the P24 antigen, can detect about 95% of infections by 4 weeks after exposure and up to 99% by 6 weeks. These are considered very sensitive and are often used in clinics. Rapid tests and self-tests, which usually only detect antibodies, have longer window periods, sometimes up to 3 months. Nucleic acid tests, or NATs, can find the virus earlier, often within 10 to 14 days, but they are less common for routine screening due to higher costs. Testing too soon, like within the first 2 weeks after exposure, is unlikely to give a reliable result because your body hasn't produced enough markers for the test to detect. A negative result during the window period doesn't necessarily mean you're HIV-free. It might just mean your body hasn't yet made enough antibodies or antigens to be picked up by the test. That's why follow-up testing after the window period is essential for an accurate diagnosis. If you get a positive result, confirmatory testing is needed to verify it. Usually, this involves a different test, such as a Western blot or an HIV RNA test, to rule out false positives. This helps ensure the diagnosis is accurate before starting treatment. For those concerned about recent exposure, testing early can establish a baseline, but it's important to remember that a negative test during the window period isn't a guarantee. Waiting until after the window period, typically 3 months, and then testing again provides the most reliable answer. Early diagnosis is crucial because starting treatment promptly can improve health outcomes and reduce the chance of unknowingly transmitting the virus. Understanding the limitations of early testing helps prevent false reassurance and encourages appropriate follow-up. Using the most sensitive tests available, like fourth-generation tests or nucleic acid tests, offers the best chance for early detection. Always consult healthcare professionals for personalized advice and testing strategies. Remember, every individual situation is different, and medical guidance tailored to your needs is the safest way to manage your health.